Good morning. Namaste. My name is Naveen Rao, and I'm the Senior Vice President for Health at Rockefeller Foundation. Today, we are gathered for a conversation that has never been more urgent. Redefining global health in the era of climate shocks. Let me be clear, there is nothing shocking about how climate change is impacting our health anymore. Extreme weather has become disturbingly routine. Outbreaks of vector-borne diseases are becoming more frequent as mosquito breeding grounds spread. Flooding pollutes water, disrupts agriculture, and destroys infrastructure. Yet, as predictable as these shocks are, they continue to burden families, upend communities, and overwhelm health systems. Vulnerable communities, those who did the least to cause the climate crisis, are being pushed past the breaking point. Consider just this past year, summer in the Northern Hemisphere was the hottest on record again. For our children, it may be remembered as one of the coldest summers as each year grows warmer. Extreme heat threatens the lives of billions of vulnerable people around the world. Severe flooding across West and Central Africa destroyed hundreds of thousands of homes and affected an estimated 4 million people so far this year. Hurricanes in the southern United States this month devastated inland and coastal areas alike, shattering the myth of so-called climate havens. The storms tore through a plant that manufactures more than half of the intravenous solutions for US hospitals, forcing a nationwide rationing. Examples are all around us. There is no place safe from climate change and no one immune to its impacts. The reality that none of us are safe can feel overwhelming. I know many people are scared. I know a sense of doom and hopelessness surrounds us. I'm a physician by training, and I understand what happens when people lose hope. Hopelessness doesn't just weigh on our minds, it burdens our bodies, it sows isolation, it convinces us that we are powerless. Yet, we are not powerless. The climate crisis is an existential one, but I also see it as a tremendous opportunity for transformation. Public health has always represented the powerful idea that our individual well-being is inextricably linked with the well-being of everyone around us. Today, we know our well-being is also inextricably linked with the health of the planet we live on. We must make global public health fit for purpose for climate change. That is the focus of the Rockefeller Foundation's $100 million commitment to climate health, alongside the big bets we are making to improve lives through agriculture and renewable energy systems. Redefining global public health for climate shocks will require all of us to work in new ways, including ways that our field has found challenging in the past. First, we see collaboration at the heart of this effort. Meteorological agencies and health systems working hand in hand, donors aligning resources, and sectors innovating together to protect their communities. Collaboration. Second, we also need precise intelligence supported by global networks, so leaders can predict and prepare for climate-related health emergencies and position resources. So that's predict, prepare, position, the 3 Ps, where they are needed the most. Finally, we know that building trust through effective communication is vital to warn people of their risk and help them take life-saving actions. We believe we are on the brink of another transformation in the field of global health, one that will redefine what it means to live and thrive and to build future where health and climate justice are inseparable. Universal health coverage, vibrant cities that adapt to our challenging climate challenges, global financing that supports the most vulnerable, clean energy. These are not distant dreams. They are achievable and they are imperative. At today's session, you will hear from leaders who are at the forefront of the climate and health transformation. Those developing new infrastructure, deploying innovative solutions like parametric insurance, and piloting new approaches to tracking infectious disease outbreaks. They are the frontline warriors. In our second panel, we will hear from funders who have committed to financing joint climate and health action about opportunities to align, enhance, and increase funding. But before we start, I ask you to take a moment to reflect on your life, the things you cherish, the traditions you hold dear, and the future you want for your children and grandchildren. Last year on this stage, I read a letter to my grandchildren about the future I wish for them, a future where summer days are not deadly, a future where our favorite foods are abundant, a future where all people are protected, and where meaningful action has been taken to limit the warming of our planet. Find your personal reason, hold on to it, and let the vision of a future you are fighting for fuel your work. Within your sphere of influence, whether through your personal choices, your research, your funding, your advocacy, your leadership, you can take part in this transformation. So let's begin. I'm pleased to welcome the moderator of our first panel to stage, Henna Hundal, Stanford medical student and climate health advocate. Henna.
Thank you, Dr. Rao, for that kind introduction, and it's a privilege to be here with you all today. As we know, the prospect of tackling climate change can feel daunting, but there are communities on the front lines working already to protect their health and well-being. Local leaders, healthcare workers, and others are on the front lines trying to turn the tide of change, and I'm so privileged to welcome 5 of these leaders to the stage today. I'm privileged to welcome Dr. Lourdes Oliveira, who is the Vice President of Research at Fiocruz and a virologist based in Brazil. Also privileged to welcome Rachel James, Regional Coordinator at the Risk Communication and Community Engagement Collective Services, who is based in Nairobi. We have Dr. Farjana Jahan, an Associate Scientist at ICDDRB, an international health organization based in Bangladesh. We have Dr. Sahil Habar, Senior Coordinator at the Self-Employed Women's Association in India. And we have Daniel Arizpizabal, Regional Head for the Amazon Conservation Team, who is based out of Colombia. Can we give a round of applause for our wonderful panelists? So, Dr. Oliveira, I want to begin with you because infectious disease, I feel, has been top of mind lately. We, of course, had the COVID-19 pandemic, and then we had Mpox, which was declared a global public health emergency twice in 2 years. So given your background in virology, what concerns you most about the impacts of climate change on infectious disease patterns? And how do you go about thinking, how can we really prioritize diseases to study as the health risks posed by climate change evolve?
Good morning for everybody. I would like to thank very much for the invitation and the opportunity to share some experiences, and a greeting to my panelists, colleagues, and especially for you. Well, it's really challenging because changing on environmental conditions can really change completely the scenery, not only for viruses, especially but for any kind of pathogen. And so, for example, you can offer a better opportunity to novel interactions between different species. And so it's a real risk for spillover. Right. And then from this new situation can come another virus, a novel virus, or even reemergency of something that was circulating before and then came up again. Depending on the characteristics of this virus, like transmission, adaptation to the host, you can be seeding a new epidemics, or a new pandemics. Also, the climate hazards, they favor some biological aspects from the pathogens, and so can enhance reproducibility, can enhance virulence, transmission, and so on. And more than the pathogens itself, also the vectors and reservoirs. And so it's real challenging. And I would say the last point on the viral perspective, and sorry, but it's a little bit bigger, this response. In fact, it can change completely the distribution pattern, not only under the temporal, as the geographical point of view. So let's take 3 examples. Airborne viruses, and so I will take my beloved influenza, that everybody was expecting a pandemic like we had with COVID for an influenza virus. And so usually influenza virus is circulating in tropical areas all over the year, but in the temperate areas, usually at the winter time and cold season, if you are warming, so you will increase circulation of influenza and also increase the possibility of reassortment, and then a novel virus or subtype or even viral variant come up with different virulence or transmission pattern. Let's say arboviruses, and we are like traumatic this year in Brazil because it was the hugest epidemic we did have, with more than 6 million cases and more than 5,000 deaths. And so areas where you didn't have dengue, for example, in Brazil in the south, or even the other frontier countries, the border countries, or Europe, US, the global north, now you have the mosquitoes, you have the vectors. So you have the entrance, not only of dengue virus, but Aedes albopictus, for example, that you have, it's endemic in Europe. It can host more than 22 viral diseases. And so it was not a threat in the former time, but it's a threat right now. Yes. And then I will pass on I will jump another waterborne, but then speaking about under the perspective of our perspective, the human one. So you have migration, you have many factors that favors the most contact with different pathogens, amplifying the viral evolution capacity, and overall, only to resume, I think inequity. Yeah, because, for example, besides the infectious diseases, you have the influence of non-transmitted diseases. We are under a demographic transition, and this population has higher levels of comorbidities which aggravate the viral infections and other infectious diseases. So I try to, there's too much more. I'm available for later discussion. It's a passion, I'm sorry. And when I started talking, I was nervous before, but when I start, I'm passionate about the subject. So thank you very much.
Thank you. Thank you for that contribution, Dr. Oliveira. Rachel, moving on to you. We know that refining our communication around climate change can be critical to promote behavior change. And I wonder, in your line of work, have there been any lessons that have emerged from your initiatives that kind of give us a clue as to how we can really refine our communications and make it easier for people to want to protect the health and well-being of their communities.
Yeah, thank you. Can anyone hear me? No? Yes?
Yeah, it sounds good.
Okay. So it's really important when we're talking about supporting communities to change their behaviour that we're really focusing on two-way communication. So not just sharing life-saving messages with communities, but really listening to what are their concerns, what are their needs, and then developing those messages from there, but also other activities as relevant. So when we have these insights, it helps us to shape our messages and our communication activities. But often response actors believe that communities aren't behaving in the way that they want them to because they assume that they don't have the right level of knowledge around the particular health or climate threat or that they have a low level of risk perception. So it's really important that we listen to the communities and then we share what those issues are with decision makers so they can adapt accordingly. So earlier this year, as an example, I was in Zambia supporting them around the biggest cholera outbreak that they have on record. And one of the reasons that this particular outbreak was so severe is that people were dying at home in the community. And the decision makers didn't understand why that was, but assumed that it was probably because they just didn't understand. But it's really important that you talk to people and find out what the real issue is. So I went into hotspots in Lusaka where the most number of cases were at the time. And I worked with partners like UNICEF, Red Cross and others to listen to communities. And I talked to people that had had cholera. I talked to people who had lost loved ones to cholera, to Red Cross volunteers who were going door to door, and also visited and talked to families in the cholera treatment units. And what I found out was that people knew a lot about cholera. They knew how to prevent it. It wasn't a new disease in Zambia. But the issue was that they didn't have the financial or the physical means to actually go to the facilities when they had symptoms or to be able to protect themselves. So things like chlorine, soap were too expensive. They couldn't afford oral rehydration solution. And given that the streets were flooded, they weren't actually able to get there. They had received a lot of messages around how to treat cholera, but in many cases there were too many messages and they weren't sure which were the most important ones. There was an oral cholera vaccine, but it was only being provided at health facilities during working hours, and so men who were the most number of cases weren't actually even aware in many cases that it was available. So once you synthesize these findings, which can be done really quickly, just in a couple of days, you can share them with decision makers and make key recommendations for how they can be actioned. So some examples of what we did. We made sure that we made the communication really clear and focused on the three things that needed to be done to stop cholera, the 3 C's: clean water, clean hands, and early access to care. And with these messages, people were able to protect themselves. We were able to give Red Cross volunteers chlorine so that when they went door to door, they were able to give people access to safe water. And we provided oral rehydration solution through drop-in centres and also staffed those with ambulances that were available to take critical patients to hospital straight away. And finally, we changed the way that the vaccines were being rolled out so that they were available where men could access them as well, so on Sundays in church. So all in all, the biggest thing to take away from this is that you need to listen to communities. And you can do this really quickly. The data that we gathered and shared had a significant impact on the number of cholera cases and the number of deaths. And this was recognised by the Ministry of Health as one of the most critical parts of the response. Since then, the Ministry of Health have used these rapid qualitative assessments that we did to find out more about what communities are thinking about drought and even about mpox now that Zambia also has cases. And this has been done through partners that have also been trained to be able to collect, synthesize, and share these results for action really quickly.
Thank you. Thank you for that contribution, Rachel. And I really enjoyed how you mentioned the importance of bilateral communication and listening to communities. And that's actually what I want to ask you about, Dr. Jahan, as well. So I know your line of work is in environmental pollution. And that's, of course, such a huge issue, pollution affecting morbidity and mortality around the world. And I wonder if you can give us a window into how it's particularly impacting health in Bangladesh. And is there one intervention that you've worked on that you're particularly excited about or you find promising?
Thank you, Hannah. So first of all, I would like to say, Willkommen alle, Shubho Shakal, Guten Morgen. So this is Farjana Jahan, and today as I'm sitting before you, I'm representing a country that is in the forefront of climate change, Bangladesh. And if I'm talking about environmental pollution, so environmental pollution, climate change, and health are intricately related in terms of Bangladesh. So there are many environmental pollutions that we are dealing with that is leading to climate change, but some of the pollutions are due to the climate change effects. So for instance, we are facing a lot of air pollution, so we know that is causing the global climate crisis, but then due to different climatic hazards like extreme flooding, we are having water pollution that is causing the outbreak of waterborne diseases. And about intervention, if I found that I find promising, I'd like to share a story. So one intervention that has been able to not only reduce the environmental pollution, but also to improve the health of the people by reducing the exposure to extreme heat. So the story began with that, if you know that Bangladesh hosted 1 million of Rohingya refugees in 2017. And after the mass influx of that population, it was a challenge for everyone to provide shelter for this community. So there was rapid deforestation done just within a few months. And what happened after this deforestation is not only led to environmental pollution, but the climatic disaster like landslide increased by 50%. And while we are working on reducing the environmental pollution, we thought that we should come up with a better solution because the houses that have been made in this camp are made of plastic tarpaulin sheet, which are not durable at all. And every 6 months that's been replaced, that is creating a huge amount of solid waste. But on the other hand, if I talk about the health effect, the people who are living under those shelters are living in a hot, humid condition with very poor ventilation. So what about their health? Because health is not about the external environment, but also the indoor environment. So we need to think about that too as well. So what we have done, we introduced a new housing material that is made of jute. Those who doesn't know jute, so that's a plant that relates to the jute fiber, and Bangladesh is the second highest jute producing country. So we made a nature-based housing that is heat resistant, saline water resistant, that can provide a shelter solution not for the camp, but for the coastal communities of my country. So we introduced that houses, and we have been able to reduce the indoor maximum temperature by 3 degrees Celsius. So improve the ventilation. So that's kind of one of the solutions. So we are not only reducing the pollution of plastic waste, deforestation, but we are using our local resources to make something sustainable. So yeah,
Thank you.
that's it.
Thank you for that. And continuing our focus on South Asia, Dr. Habar, I'm wondering if you can talk about your work at the Self-Employed Women's Association. In particular, if you can help us fit together that puzzle of working women, climate change, and health. How do those pieces come together, and what are you doing to protect working women amid the climate crisis?
Thank you so much, and thank you for having us at this event. Seva is an organization of 3 million informal sector workers, and we believe that for any initiative to be successful, we need to have an integrated approach, where we are not only looking at one aspect of climate change, but preferably tackling multiple needs within the community, be it their education, the livelihood impact, the health impact, the impact on their energy requirements. So we launched a campaign called the Swachh Akash campaign, which in English translates to Clean Skies campaign. And one of the key initiatives that we are focused on is a parametric climate insurance product. So just to give some background, in 2023, we piloted the product for 21,000 Seva members across 5 districts in India. And in 2024, we scaled it up to 50,000 members across 22 intervention districts in India. In both the years, our members contributed $3 towards the premium of the product, but the remaining premium was subsidized by a grant from the Adrian Arch Rockefeller Foundation Climate Center in 2023 and from Climate Resilience for All in 2024. The product did not pay out in 2023. Yet, members were happy with the overall program because they were supported with a climate adaptation solution in 2023. In 2024, the product did pay out, and almost 46,000 members out of the 50,000 members that are enrolled for the product received payouts between $6 and $30. And our members have said that some of them used it to buy medicines and food ration for their children. Some used it to buy school uniform and books. Some used to reinvest it in their own livelihoods and purchase fertilizers and seeds. And then some actually used the payout money, to repay loans that they had taken from local money lenders at extremely high interest rates. So the reason why we feel that the product has a chance of being sustainable is that if we are able to combine the insurance product with some other value-added products going forward. It could be financial value-added products like a parametric loan product, like commitment savings products, like a contingency loan that triggers when there is a climate shock. Then the community will receive value even in years where the insurance doesn't trigger, like it didn't in 2023. The other key aspect for us as we go on this journey on climate insurance is how do we make the product sustainable? It might not happen in the next 12 months, might not happen in the next 24 months. But we believe there is a roadmap where we can have the members' contribution of the premium rise every year, and over a period of 3 to 5 years, the entire program can be financially sustainable just based on the contributions that SEWA members make, and we can wean off the support from grant funding. But the key to do this is to ensure that we work on the insurance plus plus concept, where we layer the climate insurance with other value-added services. So some of the value-added services, as I said earlier, could be a parametric loan product or a contingency line of credit. But we also need to work on non-financial innovations like early warning systems, health advisories, having a robust climate health campaign in place. And by doing this, we feel that the communities will really benefit over a longer period of time.
Thank you very much. Thank you, Dr. Barr. And kind of continuing with this theme of learning intimately from communities and working with and for them. Daniel, I know your background coming to this panel is in conservation, particularly working with the indigenous communities of the Amazon. And I wonder if you can paint a profile for us of how climate change is impacting health specifically within that region. And what are you doing to help mitigate those impacts?
Thank you, Hannah. Thank you, everybody, for having us. I guess we have to travel to the rainforest in 2 minutes, so please bear with me. The rainforest, as it is defined, the Amazon, it's a place where it rains. And this is really what is happening. It's no longer raining in the Amazon. The Amazon is turning into its opposite. It's turning into a desert. And people are usually used to and adapted to living with flooding in the Amazon, but not with extreme drought. For example, just this year, up to October right now, there's been 2.5 million fires in the Amazon. The Amazon River this year, it's the driest it's ever been. There's places that you could actually cross the Amazon River walking. This is something that indigenous people have not been ever experienced and adapted to. So what this is happening in reality, and this is something that we've learned by talking to indigenous people, is that they live in the forests, and I guess I'm talking here to all the forests in the world, according to what they know as the ecological calendar. So what is this ecological calendar? Is this calendar where you actually, through climate, through ecological processes, understand how to live in an environment in a certain time and place. And this is not just for growing crops, this is for fishing, for hunting, for summoning the spirit world, for having celebrations, for knowing when to migrate to different places, for knowing how to live in the forest. The ecological calendar right now is being extremely affected by climate change. And therefore, it's no longer a calendar. People say, and this in many indigenous languages have seen this, it's a dyslogical calendar. So understanding this new dyslogic is what needs to happen. How do you adapt? How do you make decisions in terms of a new calendar that's unpredictable? And this causes, I think, 3 main problems. The first problem is that if the ecological calendar is not working, therefore the forest is not producing the richness that we're all taught that the Amazon forest has. food, seeds, animals, safety, non-timber forest products. The first thing here, the first victim of this is food sovereignty. And in places like the Amazon, people still depend on the food they grow and the food they hunt and the food they fish. The second problem, which is more related directly to medicine, is medicinal sovereignty. The traditional plants seem to be, in many cases, more susceptible to climate change. So you're losing also the capacity to grant medicine. And then there's a third issue that is very important that we've actually understood talking to indigenous people, is what I call, I guess, an existential crisis. Indigenous people, many people in the Amazon feel that it's their responsibility that the world works. You know, their mission in the world is to protect the whole world, not just the Amazon, through their thought, through their spiritual practices. And this is because they can predict the weather, they can predict where the spirit world is going, where the animals are going, where the cycles are happening. But now that this is unpredictable, they can't do that. They can't do that for us, the rest of the world, but they can't do that for their own communities. And this creates a whole set of psychological effects on climate that, of course, affect the livelihoods and the way people live in the forest. Therefore, it's not about learning it's not about learning from indigenous people, but now it's about learning with, because the factors are new. So this traditional knowledge needs to work together with health practitioners, with government officials, with NGO sectors, with the academia, to create a new knowledge that adapts to the forest and a changing forest.
Thank you very much. Thank you all for kind of providing a lay of the land in terms of your particular area of work. Now we're going to shift gears a little bit to talk more about solutions, and we're going to take a hard right turn to talk about infectious diseases. So, Dr. Oliveira, I'm wondering, when you think about helping communities prepare for climate-related infectious disease risks, what measures do you hope to see implemented at, let's say, a regional, a national, or an international level?
First of all, of course, adaptation and mitigation. That's the basic homework. But I would say we must enhance surveillance. Yes, and as fast as possible implement the best early alert systems. Surveillance must be comprehensive and using One Health approach. Otherwise, we are not able to really control anything. And more to prevent the problems. We have to anticipate, to forecast the risky situations, and then, in fact, to make the health intervention. And so in this field, I would say that the digital health is absolutely pivotal, of course, especially for data analysis and the new technologies. And so beyond that, to reach this point, we need I would say the first step is research and development. And so it's extremely important to generate knowledge, especially for this new scenario, and really translate this knowledge into actions, tools, and the tools to fight and to tackle all the big challenges we do have. As I have a little time, I would like only to complete the former question about priorities. Yeah, so and the blueprint from WHO, it's a program, a research and development program for health emergencies. And so they met over 200 specialists in viral families, and from more than 50 countries. And so they made an evaluation and assessment, and they had set up the list of priority viruses per region, because of course the scenarios are totally different in between. And of course, I know by mind South America, but I invite everybody to access the R&D blueprint. And so you have the lists over there. For South America, it's influenza, coronavirus, hantavirus, arboviruses too. And now I think I got time. Oh, a very well behavior girl. Okay, thank you very much.
Thank you very much. Rachel, turning to you, so you gave us kind of a profile of communication and behavior change. And, you know, unfortunately, a lot of public health is based upon trust. And many polls and data and research has shown that in the aftermath of the COVID-19 pandemic, trust in public health and these sorts of institutions have been eroding. And obviously, trust is very important for climate communications as well. And I wonder, what tips can you offer? I know this is a large question, but if you can have a go at it, how do we actually restore trust again in science communication and especially climate communication?
Yeah, thanks so much, Hannah. So for me, I think we bring back trust by really listening to communities and understanding what their concerns are and what their barriers are to behaving or to preventing different diseases and being able to address them in the ways that are acceptable to the community itself. So we need to start by asking communities who it is that they trust and knowing that different members in communities are going to trust different messengers. So young people, people in urban versus rural places, women or men, they're all going to be trusting different messengers and listening to different channels of communication. So we need to find out who it is that they trust, and then we need to reach them through those different channels. So you'll be sharing messages through a multiple different channels and messages. We also need to be prioritising the messages that we are sending so they're actionable. And so we're letting them know which are the priority messages that are going to make the biggest difference in, whatever health or climate threat that it is that they're facing. We need to be aware that those messages are going to change across the course of an outbreak, and we need to be adapting messages based on how the community is perceiving the response, but also around different events in these dynamic outbreaks. For example, if you have vaccines that are available, you need to be thinking about how you can communicate with the people that you're trying to vaccinate, and particularly if those are health workers and they're more at risk, we need to be thinking about how we can take their concerns into account as well. And then on the other side, we need to be making decision makers aware of what the key issues are that the communities are facing. So how can they address the barriers that the communities have to protect their health? We need to be thinking about how decision makers can best address these by advocating with them to make it as easy as possible for communities to act. So looking at how we can strengthen national capacities so that we can better listen to communities, and finally communicating back with communities what those key actions are that we've taken on their behalf. And I think this is going to be what brings back trust in the current emergencies that they're facing, but also for future emergencies that they'll face.
Wonderful. Thank you very much, Rachel. Dr. Jahan, earlier you mentioned that Bangladesh is one of the most climate vulnerable communities, or countries rather, and that those impacts can be felt often on a local level, particularly for example, coastal communities. I'm wondering, with your environmental health intervention background, what tips can you offer for design, implementation, and scale-up of community-based initiatives?
So I want to say we believe in the community involvement in every intervention development. That's the key to your success, because without community involvement, if you introduce something new out of head, that's not going to be acceptable or sustainable in the longer term. And suppose when I'm talking about this jute material, we made sure that this material can be made by the community itself by a hand-laying technique, without using any electricity or other energy sources, because the place I am talking about, the marginalized population, they don't have access to electricity, and we don't want to bring something from outside to make their houses there. But also, we looked at the community preference for the design itself. We did the consultation with the community members, and if I give an example, so we are working in the same place, the coastal area of Bangladesh. One is the refugee camp, and another, the local community, which is Bangladeshi people. And kind of similar cultural context, but such a different view, because when we talked about how do you like your house, so the coastal people of Bangladeshi people, they're like, okay, it should be durable, it should have like windows on that side, it should be heat resistant because it's very hot and humid. And then we talked to the woman who is living in the camp, and the view was completely different. And she was, okay, I don't want window in my house because the houses in the camp are so closely congested. If they open that window, the fear that someone can peek through that, and that's affecting their dignity, their privacy. And we thought, okay, so what should we do? Because we need to improve the ventilation, we need to have adequate light in the house. So what we made the roof trans-opaque, so the sunlight can directly enter the house through the roof. And we made a ventilation in the upper part of the wall, so they don't fear of privacy, and we have adequate light and ventilation. So that's how respecting the community perspective, respecting the community preference is important. So this is how we did it.
Thank you very much, Dr. Jahan, especially for that interesting anecdote. Dr. Hibar, earlier you basically told us the ways in which climate change disproportionately impacts women. And I wonder if you can share, kind of at large, what are strategies for better integrating their participation into climate solutions?
Yeah, so I think we need to collect more data on the actual impacts of heat and climate change on the informal sector. So just in India, 90% of the workforce is in the informal sector, and many of them actually are exposed to the direct effect of sunlight. But right now, we don't know what their lived experiences are, and we don't have enough data on the physiological impacts of heat. So the data that we get from the Met services actually vary widely from the places of work. And that's at least the preliminary data that we have collected in our research with Harvard University over the last 6 months. So should the government be using the microclimate data to inform their policies? Should we use those data to actually create more effective programs? I think that's some area that needs more research. The other thing is, should we be using just air temperatures, or should we be using wet bulb globe temperatures in our decision making? I spoke about climate insurance previously, but can we have a predictive model where the payouts are predictive so that the women don't have to actually go out and work? Because right now, because it is reactive and the payout is coming post the event, many of them are still going to work and are suffering from the health impacts of working in extreme temperatures. So I think there's a lot of scope. Sorry, just one final thing. Even the climate adaptation solutions that globally is being discussed, I think there's more data that needs to be collected on what are the most effective climate adaptation solutions and which can be scalable at a very cost-efficient manner. So I think these are areas of research that we need more data on to inform policy decisions.
Thank you very much, Dr. Hibar. And Daniel, similar question to you. So given your work in the Amazon and engaging indigenous communities, what lessons or tips can you offer for those of us here who work with indigenous communities at large? And also, what can we learn from indigenous communities about indigenous knowledge, and sort of what is that interplay between environment and health?
Oh, thank you. Well, I think something that indigenous people have been mentioning a lot is the interconnectedness of all things. Everything's connected, including the ecosystems and culture. And climate change is reminding us of that. The effects are seen everywhere. So we need to bring interconnectedness, system thought in the decisions and the solutions that we make. And to do this, we need to bring conversations. Sometimes it sounds almost silly, but conversation is the most important thing, because the impacts are starting to be felt right now, but the conversation is lacking. So bringing this knowledge together and having these conversations is really important. And it used to be that the recipe was learning from local communities. I think now we have to learn with local communities. And this is a change shifter, because it really means opening up and adapting to creative and new solutions. And what we mean about creative and new solutions, and I think about bringing back to your question about what we can learn about indigenous knowledge of the ecosystem, is that we tend to think about indigenous knowledge that's stuck in the past, but it's not. Indigenous knowledge also changes with time. And this is really the key to the future, is that this new change of knowledge happens together, both with Western medicine and traditional medicine together. So mixed models of intervention that incorporate traditional medicine and Western medicine together are key to move forward, but particularly looking at the self-determination and the self-capacities of communities. So for example, bringing back seeds that were lost, bringing back hunting game that was lost, that we know how, that old people know how to get, or developing new ways to harvest in the forest. These all need to be solutions that are being easy to implement in the ground, but that require knowledge from both sides to implement. Training indigenous people in both types of medicines, and that they are certified and able to apply it up to apply it in their territories is key also, because now they could be aware and detect what diseases come from the indigenous world and what diseases come from the Western world. So.
Thank you very much. And now as we begin to transition into our second panel on funding, and we might even have some funders in the audience, I'm wondering if each of you can quickly share what take-home message you want to leave everybody with. How can funders better support the scale-up of your work at engaging frontline communities?
Yes, of course, firstly of all, research and development, especially in the low and middle income countries. There are lots of gaps, yes, of knowledge to really tackle and respond to the challenges. And so it's extremely important to have this support. And many times the solutions don't require great efforts, but you have lots of social technologies that could be invested, because there in the global south that we will be the most affected part of the planet, although not the biggest polluters. And so I think the minimum to be done is really to have a real support to our region. Thank you very much.
Thank you.
So for me, it's just so important that we're listening to communities and really capturing the key concerns that they have and implementing policies and activities to respond to climate and health threats that they face. Sorry. So we need to be funding local actors to be able to listen to communities, to collect these insights and to be able to share them with decision makers so that those decision makers can rapidly make the changes that they need to see. So I would be requesting funding to be able to support ministries of health and civil society response actors to be able to better strengthen their capacity to talk to communities, to collect this data, to synthesize it and then share it for action.
Thank you.
Thank you, Hannah, for this question. This is very important because I often found there is a funding for developing a solution. So we pilot this, we generate some excellent evidence, then there is less appetite to take it forward. So we need a sustainable funding for scaling up the solution, not just piloting and generating some evidences. And also, I want the funders to prioritize the local efforts. Of course, the local solution, the local resources. And, we don't want someone sitting on a air cooler condition talking about the heat in Bangladesh. It has to be the people in Bangladesh who should be designing their solution. So you need to prioritize that.
Thank you.
Yeah, Hannah, I'll echo what my co-panelists have said. I think there is a lot of scope for research, for impact research. And to construct pilots that look at local solutions, that look at communication strategies, but it has to come from within the community, and it has to be in an integrated manner where we are trying to tackle multiple problems and not just one siloed approach where we are targeting one problem at a time.
We've been hearing a lot that local communities are the most vulnerable to climate change. But I think forest dwellers are not also the most vulnerable to climate change, but they also hold the solution to climate change. So therefore, it's ironic that the people that suffer the most are the ones doing the most for climate change and have the least responsibility. Therefore, we should listen to them that the health of forests is the same thing as the health of humans and the health of the world. Therefore, financing the protection of rainforests in the world is key to combating climate change and health.
Can we get a round of applause for all of our panelists? Thank you all very much. That laid the discussion wonderfully for transitioning into our next panel, which is on funding these very collaborations that you all talked about. So thank you very much. And I'm pleased to introduce the moderator of our next panel, senior correspondent at Time, Alice Park.
Thank you, Hannah. It is my pleasure to be moderating this next part of our session. We've just heard about some very powerful programs that are addressing climate's effects on health. And we'll spend the rest of this session exploring an equally important component of those programs, which is ensuring that they have the financial support that they need in order to succeed. And we've heard from some of the previous panelists about how important that is. So I'd like to invite our panelists up to the stage to join me. It's my pleasure to introduce Vanina Laurent-Ledru, who is Director General of Foundation S, Alan Dangor, Director of Climate and Health for the Wellcome Trust, Gabriel Lung, Director of the Institute of Philanthropy and Executive Director of the Hong Kong Jockey Club Charities Trust, and Peter Sands, Executive Director of the Global Fund. Thank you all. So Alan, I'd like to start with you to sort of set the table a bit. And we've heard about some of the programs and solutions in our previous session, but I'd like you to set the table and tell us a bit about the increasing frequency and intensity of climate-related health impacts, including of diseases that may not initially be obviously climate-related, like dengue and cholera, which we heard about earlier. So tell us really what those patterns are looking like now.
Fantastic. Thank you very much. Delighted to be here. And thank you to the Rockefeller and Naveen for hosting this fantastic session. It couldn't really be more important that we have, again, climate front and center at the World Health Summit. And I think we heard yesterday a really strong commitment from many countries to act on climate change and the impact it has on health. And the reason we've heard that commitment is because the evidence is now abundantly clear that there's an enormous acceleration in the impacts of climate change on health. Extreme weather events are becoming more severe and more frequent, and we are seeing around the world these effects and the impacts that they have on human health. The most direct impact, of course, is extreme heat, and we've seen this year frightening temperatures around the world. And an alarming increase in heat-related mortality. We've also seen the impacts on food security, impacts on the spread of infectious diseases. And these are being seen and most immediately felt in the most vulnerable countries in the world. So that's the story. We all know the story. What are we doing about it? How are we going to respond? How are we as an international community of researchers in health, how are we going to actually tackle that and really make a difference? So within Wellcome, we've put this issue front and center in our new strategy. We have very clearly stated that the impacts of climate change on health are going to totally shape global health. And we therefore need to have a strategy which tackles that head on, both measuring the impacts of the climate change on health at the local level, and some really important points in that last panel on the need to understand at the local community level the impacts of climate change on health so that the solutions can be appropriate. But also then understanding the benefits to health of rapid decarbonization and building and understanding those adaptations that can best respond to climate change and protect health. We're conducting, we've exploded really the field of research in this area over the last 2 years and 2.5 years, and it's incredibly exciting to see the other philanthropies that are joining us on that mission. But we're also driving in new areas, and I'm just going to mention a couple. The first is that as this is a new area of science, there's some new science that needs to be done. And that new science, particularly, for example, in things like attribution, understanding how to attribute the impacts of climate change on human health, is a new area of science where we're investing heavily. But secondly, we talk about the intersection between climate change and health, but most people, I bet, in this room are health professionals or come from the health sector. There are very few people in this room who come from the climate sector, and yet we're talking about climate and health. We cannot do climate and health without climate professionals and the climate services. So it's very clear that an increased investment in the climate sciences and the climate services to provide that evidence for decision makers is going to be critical, and Wellcome and others are really delighted to be driving that forward as well as part of our mission.
Thank you, Alan. Gabriel, let's turn to the country level now, and I'd like to ask you about how countries can fund what Alan was talking about and help support the need for new data and to really establish a baseline with this new science, because there is so little that we still don't know.
I think it's incredibly important that we, first of all, speak the same language. And in this space of the effects of climate on health, data and the digital infrastructure is the language. And I think that so far, we've probably still been speaking very different languages in very different tongues. We all are converging on what hopefully needs to be done, as Alan has said. So I think that this, as Alan put it, explosion of climate and health science requires us now to also converge on the data architecture and requirements, so that we all are talking about the same things and measuring similarly, so that we can all get to the same place that we're now starting to agree on. So that's number one. Number two, what is the role of funders? You've got a whole bunch of funders sitting on the stage. I think one shouldn't overestimate what funders can and should do, but one shouldn't underestimate what we must do. Now, if you look at all of the endowments all added up together, they wouldn't even pay for one whole year's worth of regular OPEX of what needs to be done. So by definition, philanthropic capital has to be catalytic. It has to be leveraged, it has to be synergistic. And therefore, you have to find the right gaps and niches where you could most maximally deploy your dollars such that you catalyze the whole field, and government then has to take over. And of course, there's the role of multilaterals, which by definition are norm setting, they are coordinators, and they hopefully will then be able to converge with national governments and member states to this greater data architecture for the whole world, because unlike many other sectors, climate science and its effect on health probably doesn't originate from where you actually live and from where you are serving your local population. So I think that's really what I think funders' responsibilities are, that is, go and be the catalytic capital, go and be the pilot, go and be the trial, because it's much easier for funders to fail than for governments to fail. And so our role is really to go out there, try new things, test it out, and then pass it on. And hopefully, then we will get to this explosion of science-led action in the adaptation process.
Vanina, do you agree with what Gabriel said in terms of the role that philanthropy can play as a catalyst, and particularly at the community level, it seems? And it's fascinating to think of the sort of role that you can play in doing those small pilots to kind of test and trial new ideas. You agree with that? And what role can philanthropy play in helping communities in particular get the resources that they need?
Yes, thank you for the question. Thank you very much for having me here. Thank you to the Rockefeller Foundation for this great convening. So I very much support that. We at Foundation S operate as a think and do tank. So it's very important to us to actually do the thinking so we can identify key ideas, because you need to catalyze action, but you also need to know how we can fast forward the thinking. But talking about the do tank, one thing that we've put in place are community-led grants. We've committed 40 million euros to 2030 for that. And it's very important to us to understand how we can continue support, capacitate local communities. Let me give you an example. We were in Bangladesh before, and I was so pleased to see Farja Jahan, one of our grantees, on stage. But one thing that we've seen in Bangladesh is that one cyclone shelter was constructed on the wrong side of the river. When a cyclone hit, the community could not cross the river, mostly because the local community had not been consulted. So that's the type of adaptation opportunities that we are missing if you are not doing work right with the community. So that's why it's so important to support organizations like IDCCR and others. What we are seeing as well is, to give you another concrete examples, it's very important to ensure that you can do healthcare workers capacity training. And we've heard it left and right. Healthcare workers are the blood and the lifeline of healthcare systems. They are not sufficiently recognized, they are not sufficiently empowered, and they're just not sufficient in numbers. But what we need to do is exactly what Alan has alluded to. It's bring the climate community in the discussion. And for this, you need to ensure that you have early warning systems for when climate disasters are going to hit, connected to healthcare professionals training, to ensure that the healthcare professionals are ready when there will be floods, when there will be a cyclone, when there will be another climate event. So we're doing this in Chad, for instance, supporting a system there to ensure that whenever there's a flood, well, the whole healthcare community is ready, medicines are no longer stored on the floor, and everybody gets ready for waterborne diseases. I would also like to emphasize one thing that we're launching at the end of the month, again on the community angle. We're opening up this local solutions campus. We're bringing 16 countries, mostly from West Africa. If you're in Africa, come join us in Dakar. We're bringing more than 200 different representatives from the partners, from the community and the NGOs that we work with. And the reason we're doing this is because I sit in France. I don't have the keys to those adaptation solutions. We need to make sure that we can empower those that are on the front lines and ensure that they share their own best practices and failures. It's very important that we share what is not working and maybe be more courageous on stage for next World Health Summit and share one failure at every panel.
I think that's a very important message to keep in mind. And Peter, picking up on what Vanina said about the importance of collaboration and really thinking in a multi-sectoral way. The Global Fund was an initiating endorser of the guiding principles for financing climate and health solutions launched at COP28. And those principles obviously set aside $1 billion in commitments to climate and health, and has been endorsed by 50 organizations. They emphasize the principles of equity, transparency, and collaboration. So I wonder if you could talk about what some of the biggest hurdles have been in bringing those principles to reality, as Vanina was saying. You know, how difficult is it to work at that local level and to bring those principles to life?
Right. What are some of the problems?
We learn from problems, right?
We learn from problems. The first is, it's absolutely true that there's a lot about the impact of climate on health that we don't understand and we need research. But that should not be an excuse for not doing anything. There's a bunch of no-brainer stuff that we need to be getting on with. So we can't let the need to know more get in the way of acting. We need to be able to kind of learn and do at the same time. The second is a point that was made, I think, very compellingly by the last panel, which is there's a temptation with things like this to take a very technocratic top-down approach. And there is a virtue to technocratic top-down approaches in some circumstances, but all too often the answers are known to the people in the front line who are facing the situation every day. We need to be listening. A second problem I would highlight is that it's very easy to get entangled in the complexity of the kind of institutional and funding architectures. The global health world is quite complicated. The climate world is also quite complicated, as I've learned. The food security world is quite complicated. They all have a profusion of agencies and acronyms and ways of talking about things, and you can spend an awful long time just trying to cut through that kind of mess. We owe it to the people who are most threatened by the impact of climate change on health to kind of cut through all that, and also to be prepared to operate outside our silos, because it's the same people being affected by these threats. There's a third obvious obstacle, which is we actually have to find the money. Sometimes people say to me, because the Global Fund is investing about $5 billion a year in health, can't you just kind of find it somewhere? You'd be surprised how difficult it is. I mean, we have huge funding gaps in many of our core areas already. We are funding through the requests from countries a huge amount of things connected to climate change. But I'm also sitting right now on about 500 million of technically reviewed, robust, but unfunded requests for countries for specific programs and support on the impact of climate change on health. So there is a massive need out there that we simply don't have the resourcing for as yet. And that's why in August our board approved climate and health as what we call a catalytic priority, which basically enables me to go out and raise money specifically for this challenge. The thing I would want to underscore is a sense of urgency. I mean, we have gone from having a lot of discussions at COP28. It was great to have the first Health Day at COP28 and to get agreement around the principles. But I'm now getting calls pretty well every week from ministers of health around the world who are dealing with specific issues related to climate. Most recently, Maiduguri in Borno State in northern Nigeria, massive flooding. What does this mean? Well, we're working with the Minister of Health there on how to counter what we know will happen, which is a big surge of vector-borne diseases, particularly malaria in that part of the world. But secondly, the main lab for the state of Borno lost most of its equipment in the flooding. So there's no viral load testing, no molecular diagnostic capability there anymore. So there is a real sense of urgency about, in a sense, how we, within the funding side of the equation, get our act together so that we can provide the support that I think was so eloquently, the need for which and the ideas about how it can be done was so eloquently described in the last panel.
So let's dive a little bit deeper into how we get that 500 million out to where it needs to go. And wonder if you can just briefly also address the difficulty or the challenges involved in earmarking funding for climate health, climate/health related programs when we've heard all throughout this session that climate really affects almost everything. You know, as we heard even in the previous session, it's building materials, it's transportation, it's pollution. How do we make sure that, how difficult is it in terms of, you know, the Global Fund being able to say you need to have a climate focused, you know, program or data supporting that this will have some effect on health if we address this. How do you work through that and ensure that that doesn't become an obstacle?
Well, to start with, I think we really need to avoid creating new silos.
Exactly, right.
Give the global health world a chance to create a silo and we'll all do it. Because climate isn't a silo, it's a dimension of pretty well everything we do. It's changing the epidemiology of different diseases, it's changing the way we think about primary healthcare infrastructure, supply chain infrastructure. I've discovered how many warehouses are built on floodplains. They're built on floodplains because it's nice flat land and you can build a great big warehouse. Unfortunately, it's a floodplain. And then you end up losing all the stock that's in it. So we should avoid creating new silos. However, we do have donors who want money focused on this particular aspect of health. So we need to be able to bridge in the way we create structures between the desire of donors to have a focused contribution and the need for countries to have what is done integrated within their broader health and climate response. And that's exactly what we do through what we call catalytic funding. But as I say, it's a balance because we want focus, but we also need to avoid creating silos that ultimately will undermine the broader objective.
And Alan, you come to this from the climate world, as you said, that is part of some of the challenge here is that so many people trying to address this are mainly from the health world, and so there's more need for that kind of communication across talk. From your perspective, how can funders encourage researchers, as we're hearing, we still need a lot of data, we need to understand all of these connections a little bit better. How can funders be more proactive in ensuring that the right research and the right data is being collected?
Thank you very much. Peter raised a couple of, many points, but a couple I'd like to really re-emphasize, also in the work we're doing. So welcome. We've taken a different approach to research. We've said, number one, this is urgent. As Peter says, absolutely urgent. We must respond immediately. We've accelerated our ability to fund research. We've pushed out a huge amount of calls for research in an ongoing way to really accelerate that field. But number two, we've asked for research to be transdisciplinary, and what that means is getting out of the silos, as Peter also says. So recognizing, and from the first panel this morning, the first panel just now, we heard the importance of understanding the local context. So really working with communities to understand the local context, developing and delivering high-quality research in those contexts, and then understanding how that can be used, how that information can be used. So delivering research that is on the pathway to impact, rather than purely esoteric academic research, which we're brilliant at doing, and which academia is classically trained to do. But here we're saying the urgency is now, the need is now, we must be delivering research that can be used. And that forces, and we are incentivizing through our funding, that forces researchers to work in a different way. And just this last week, I've heard stories from researchers we have funded who've said that the funding we have given them has transformed their ability to engage with other researchers, to engage with the local communities, and to deliver real-world impact. And I think the academic community is recognizing, and the public health community is recognizing, that because of the urgency of climate change, we must do things differently. And we're seeing that, and we're seeing that from our grantees, and that's incredibly exciting. But I think it's also important that as philanthropy, and the points that Gabriel made are very important here, as philanthropy, we also think differently. We cannot just fund research and say our job is done. So Wellcome is a funder of research. Science to solve the urgent health challenges facing everyone is our mission. But we cannot just fund science. If we just fund science, if the solution to the world's problem was an awful lot of papers published in an awful lot of journals, there would be no problems because we've done that. So the solution is clearly the link to communities, the link to policymakers, generating research which is impactful and driven and on the pathway to impact. And very clearly then we also need to engage policymakers, we also need to engage the policy processes through which this information is going to be used, funding that ecosystem. And part of the reason for our announcement yesterday, Wellcome's announcement of $50 million to the World Health Organization, was to support the WHO to embed climate within its thinking, to really recognize the impacts of climate across the whole of the work of the World Health Organization, so that every single Ministry of Health in the world understands the impact of climate change and on health, and understands the need to really redefine global health in the era of climate change. So we need the science, but we also need the ecosystem, which is going to ask for that evidence and use that evidence with urgency.
Gabriel, the Charities Trust is a relative newcomer to the global health donor world. I wonder if you can talk about the experience you've had domestically with influenza, SARS, COVID, and what lessons have been learned there that you're now applying or can be applied to, being smart and ensuring that the funding that you are providing is going to have an impact.
Well, you're right. The Hong Kong Jockey Club Charities Trust and the Institute of Philanthropy are sort of the new kid on the block in the global health funding world, but we're actually already 140 this year. So yes, anti-aging biology. And so we are an operating foundation. So what that means is that we actually have locally and domestically worked hand in hand with all of the NGOs in Hong Kong, and we literally partner and walk with them and co-create from day one. And we've done that for decades. And I think that really is the special set of competencies that I trust and hope that many other fellow Asian foundations would sort of continue with, build on, and really make sure that they do even better than what we've done. Because it's such a rewarding experience for us, but actually so critical to success. Unless from day one, from the first step onwards, that you actually literally sit down with the NGOs, with the partners, and both the NGOs and the funder actually should have ultimately a beneficiary centricity in mind. We're not doing it for us as a funder, and the grantees shouldn't be doing it for them. Both of us should be doing it for the beneficiaries. And I think that that mindset is basically running in our blood. Now, how we then try to bring that experience, which is very contextually specific, obviously, to our domestic context, how we try to use that and then radiate it using the platform of the Institute of Philanthropy, so that with all of the newfound wealth of Asia, from West Asia to Northeast Asia, and then bring everybody along together so that we can have a new form of giving, if you like, the Asian way of giving, that hopefully will be much more centered on those populations, groups, and individuals who actually matter the most, and for whom that we're all doing this. And that really is what I hope we are able to bring to the table, complementing and still learning from many of our global peers.
Vanina, similar question for you. You come to this from Gavi, the Vaccine Alliance, which has had a huge impact on improving vaccination and immunization rates around the world. What are some of the lessons that you learned in that experience that you can bring to climate? And how can funders really increase the transparency and predictability of their funding?
Thank you, Alice. So just to be clear, I'm no longer with Gavi Foundation.
Right.
This is the philanthropic organization of Sanofi. But it's very important to me to learn from the public, the private, and the philanthropic sector experience, because it's like that you can actually increase the predictability and the transparency in the funding, because you understand how accountability is created on all fronts. So with this, I will choose to see the glass half full. We have been spending, for some of you, 3 days here in this beautiful location, and understood how important it is to mobilize ourselves on putting climate in all policies, that it is so critical that we have this sense of urgency. Actually, I've seen tremendous progress in the past 2 years. I think it's fair to recognize that for once, the global health with the climate community has mobilized itself. We've seen $1 billion in commitment at COP28. We've seen a movement on climate and health financing principles to organize the space, led by many in this room. And I think this is great progress, but we can do better. Again, our first panel reminded us how important it is to fast-track flexible financing to ensure the accessibility of financing at community level. So I'll come back to this, because the fact that only 10% of the financing today reaches communities is something that bothers me, and something that we can all do something about. I will not be fair if I would not mention the work of the Climate and Health Council. So I told you we are a think and do tank. So that's the think tank of Foundation S. And this Climate and Health Council issued a report on fast-tracking flexible financing. Very quickly, 3 short recommendations. We heard the word silos. I think each of you mentioned it. Yes, it's time to break silos, but breaking silos means not just bridging the health and climate community, if you agree, but truly bringing and de-risking investments by bringing philanthropy, bringing other actors to the table, and ensuring joint decision-making. The report also says something about bridging capacity gaps. I'm not going to come back to it because others eloquently spoke about this. But the last thing I'll say is about building new channels. Gabrielle, you mentioned very important points about the local approach and how you are going into climate. I think it's really high time we invite other philanthropists to join this great club that we are building. Only 2% of philanthropy right now going to climate. How wrong is that? Can we make it 10% at least? Can you each go and see your favorite philanthropist and ask him or her, join the fight? Let's get to 10% next year.
Thank you. And finally, just want to give each of you the opportunity to address. We've heard from day one from Dr. Tedros and Bill Gates that things are very challenging now, especially because of competing interests for donors. There are conflicts, there are natural disasters. So I wonder if you could each address, how do we make that process more efficient to ensure that funding, as Vanina is arguing, should go more directly to climate-related health issues? How do we use, for example, existing funding structures, and is it possible? How are each of you looking at that and looking at existing infrastructure or programs to kind of funnel more money into health-related climate issues? Peter, let's start with you.
Right, well, the last thing we need is yet another funding mechanism. The world's complicated enough already. Look, I think the imperative here is that we focus on outcomes, human outcomes, and that we focus on the most vulnerable. Many of us are going to be inconvenienced or discomforted in various ways by climate change. But for the poorest and most vulnerable in the world, this is existential. They will live or die depending on how well we collectively help them respond to these challenges. And so there has to be this kind of relentless focus on what difference does it make to the lives of the people who are most exposed to the impact of climate change.
Gabriel.
I think philanthropies has a responsibility, a moral responsibility, to work with governments for those most in need. And I come from, in WHO lingo, the Western Pacific region. It has the Pacific Islands community. That exposure and experiential learning, if you just take fellow foundations in Asia to the Pacific Islands, I think that would convince even the most harshest critics the need and the imminent need for action on climate and health.
Alan.
Brilliant. I'd like to mention three things. The first is the need for philanthropy to collaborate. And so we've started a coalition with the Rockefeller Foundation where the philanthropies are coming together on climate and health. We're trusting each other, we're sharing our knowledge, and we're working together. The second thing is that if we just do it as a bunch of philanthropies, many of us from the Northern Hemisphere, we're missing the point. So diversifying and being much more inclusive in our processes is absolutely essential. And finally, our ability to act as leaders, as philanthropy to act as leaders, to do something different, to diversify, to experiment, to take risks, is absolutely essential. And I think that's what we're seeking to do. Thank you.
Vanina.
Thank you very much. So I'd like to end by, again, ensuring that we can break those silos. If there's one thing that we should be doing at the end of the day, it's really work across sectors. It's not about them, it's really about us, and it's a bigger us. It was not two panels, it's one giant conversation, and we need to all be part not just of a conversation, but of action. And for this, I think it's important to understand that for the private sector, working on climate and health, it's about business continuity. So for private sector colleagues here in the room, it's simply about making sure that you can keep accessing patients at the end of the day for which you're developing innovation. For philanthropies, we understood it's about making sure that you are investing in what is the most important topic now. And for other sectors, I think you know what the roadmap is ahead of us. So thank you.
Well, I want to thank all of our panelists. Let's have a big round of applause for them. Thank you all. And it is now my pleasure to introduce our next speaker, Dr. Ethel Maciel, Secretary of Health Surveillance and Environment in Brazil.
Hi, it's such a privilege to be here, and I'd like to thank you, Dr. Navi and Rockefeller Foundation for this opportunity. I'm not trying to summarize all of what was saying here because it's a lot and very important, but it's such a privilege to witness all these leaders that were in this space here today, talk with a lot of important topics. We hear here about the importance of surveillance, of research, of listening to community. And I would like to say that listening to community is very important, but they not only will say what we want that to be listened, because for us in Brazil, that we are preparing the COP30 in the Amazon region, it's very important to bring the research community, the leaders, the founders to this place, because many of this community, they don't trust us. They don't like us. Because especially in America, for the last 5 centuries, we only approach them to take something. So, and what Daniel say here, and all from the Amazonia region, it is very important to us. And especially, Alan, I would like to talk, to make a dialogue with what you say, because the climate research, the climate activists, was tell us from the health sector for a long time that it is important, but we didn't listen. It's like a monologue, not a dialogue. And it took us 28 COP to have one health day. So it's tell a lot what we are and the position that we have. In the COP29, we are working together with Brazil and Emirates to the COP28 to make a coalition from health to be like a permanent subject in all COP. So we expect to make this in Baku and to have a health much more strong in the COP30, because this became a very important subject for all of us. And I would like to close this remark to say to Dr. Navi, your words are very important, and we think that we have to make a better world not only in Germany, in Berlin, not only Europe, not only in the North Global. We have to have solutions for South and North together, a better world for all of us, as you brilliantly said. And it's not easy. We are trying to make our pandemic treat that is still not here. And it tells us very much about the untrust that we have between us. And it's not by chance. There's a long history of this. And in this forum, it's very important to us to recognize that we need to build trust. To build trust, we need to make conceptions. We need to make, we need to have this conversation more close and listen the South and not only have the solutions that are already in the North. We are very different, we think different, and we have different solutions for different problems. There is a lot of complexity, and I would like to finish with the Dr. Peter Sands said, in the end, the time for community is different from the time from funders. We need to close this gap. We need that the money was in place when the time that they need. So this is a call for the South Global that is in this moment suffer the most impact of the climate change, as all the panelists said here. We are the less responsible, but we suffer most, so we have to have some ways to work together to close this gap. So I'd like to invite you for the next COP30 in Amazonia, in Belém, in Brazil. Be prepared. We are like, have a warm welcome for the government, but probably not very well warm for the community that was there, that are suffer a lot with this. As Daniel said before, finally, after century of century, that the way that our way of life, non-indigenous people, we are finally took them what they are most value, the forest. So we need to realize that, and we need to work together to close the gaps and have solution for their needs. So thank you very much. Thank you, Rockefeller Foundation. And let's build this world for all of us. Thank you.